I am Dr. Jenna Mueller. I am a postdoc in the Center for Global Women's Health Technologies. I work on different projects related to cervical precancer and also low-cost laparoscopy. Laparoscopic surgery essentially uses a few small incisions to access anything in the abdomen that needs to be surgically fixed. And through one of those small incisions, they insert a laparoscope, which is an imaging device that allows the surgeon to illuminate and visualize what they're doing. And laparoscopic surgery is widely used in high-income countries like the United States, but it turns out that laparoscopic equipment is incredibly expensive. Usually there's a large tower that's as tall as me in the OR. Typically the entire setup costs over $200,000 to outfit a single OR. And so that's something that isn't feasible for use in LMICs. So often surgeons are left to do the traditional open approach, which can lead to a longer hospital stay, more time away from work, a more expensive procedure, and also infections and complications. So our goal was to bring laparoscopic surgery to places where it's inaccessible by creating a much lower cost, easy to use laparoscope. And if we compare that with training surgeons in LMICs in laparoscopic surgery, we believe we could enable access to laparoscopic surgery. Last year, we were able to develop this prototype of a laparoscope. It has an outer diameter of about 6 millimeters, and that enables you to fit it into these small keyhole incisions in the abdomen. We basically have this tiny camera and LEDs all right at the tip, and then through the rest of the device, we just have wires that go all the way back through this handle, and then you can plug this into a laptop to power the device and to also view the images. It significantly reduces the cost. We were able to build this for $120, and typically it costs over $200,000 for a standard of care laparoscope. So what's been really cool about this project is that we've been able to take what we have learned from the pocket colposcope in many ways and how we sort of leverage the human-centered design process to make that device and get it to where it is today. We've been able to take sort of the lessons learned and best practices and apply it to the laparoscope. So we took this with us to Uganda with several of the students that have participated in our Basque Connections project. And we were able to meet with surgeons to get feedback on the device. And what we learned is that they loved that it was simple. It's much lighter than the standard of care. They loved that we eliminated the tower that was required and significantly reduced the cost. Receiving feedback from collaborators in Uganda this summer helped us identify what are the most important next steps. The human-centered design framework is so essential for engineers. I think that oftentimes we jump directly to the solution without really understanding the problem. And so if we can slow that process down and really speak with end users, with the community that we're trying to create some sort of solution for, then we can save ourselves a lot of time and also come up with a solution that's actually going to be sustainable and appropriate for those environments. Traditionally, global health has really been focused on infectious disease, HIV, malaria, tuberculosis, and not quite as much on non-communicable diseases. But we're going to see increased rates of non-communicable diseases, cancer, diabetes, injuries. And so I think one of the next great frontiers in global health is global surgery and increasing access to safe and sustainable surgery and anesthesia.